Just tell me when to advance.
Sure, I certainly will do so. But for now, we'll have I'll introduce myself quickly and have Isabel introduce herself, because she's the star in some ways, going to tell you about the most exciting frontline work that's going on that I think relates well to your work and social determinants of health. I have been running this center since we founded it back in 2013. I got my PhD at University of California, Berkeley. I have been done consulting work before coming to Williams when I started as the coordinator of experiential education. And in my work at Berkeley, I was trained in political science, public administration, public policy, and political behavior, which has proven very helpful for me both here at Williams and thinking about the wider community. But I'll talk more about the way we think about things here at CLiA after Isabel gets the chance to introduce herself. Izzy?
Hi, everyone. Thank you so much for having me here today. My name is Isabel Arvelo. I'm a junior at Williams College majoring in statistics with a concentration in public health. And I was really just drawn to these fields because I'm really excited about using data-driven analysis to make sense of complex situations and provide solutions for healthier, safer, more sustainable living. And yeah, I'm excited to share a little bit more about the research we've been working on this past year and hope to continue to build upon in the future.
Absolutely. Thanks, Isabel. Okay, so we've got that opening slide. You can move to slide number 2. Thank you. So a little bit about us as an enterprise. We were founded in 2013, combining the experiential curricular side of work at Williams, where I was originally housed, with the extracurricular work at Williams, doing community engagement in an effort to make the work stronger, to do a better job, to consolidate Rolodexes, if you remember that expression from years ago. We have a tripartite responsibility. We are responsible for cultivating and sustaining experiential opportunities, as I said, both curricular and non-curricular, extracurricular, in the service of the teaching goals of our faculty, the civic aspirations of our students, and the needs of the wider community. And all three have to stay in our sights at all times. Next slide, please. So we take a holistic, collaborative, and continuous learning approach in the work with faculty, student groups, and the community organizations, as well as campus partners who we try to rope in to do the same kind of work that we're doing, or to organize their own activities that we can then help with. And the aim is to get students good hands-on learning opportunities to address pressing civic problems. We frankly do whatever it takes. If that means getting particular kinds of trainings for students, such as trauma-informed education practices and raising awareness about social determinants of health, that's what we do. We arrange whatever kind of training makes sense. We try to find out from students what they want. We also look to faculty to see what they think students need. And all of this is not just an aim to help them when they get out, but to help them get the kind of practical experience they need in order to be able to theorize and think about policy as they go through the rest of their academic experience here at Williams. And as I state here, we also follow the guidelines outlined in Stanford University's Ethical and Effective Principles of Service, which are 8 separate categories. I could send a link to people if they want it, but it's available online. Really encouraging people, and we follow this, to think in terms of everything from humility, reciprocity, thinking about
if everyone can mute themselves, that would be terrific.
Oh, sorry. Okay.
If everyone can mute themselves, that would be terrific.
Sure, thanks. But I understand we've had, it's understandable if there's an issue now and again. So in terms of our work, we think very carefully, and I suppose if you have to give one word that describes what we do, it's that we listen intently and continuously. These days, especially with conditions changing so rapidly, it's really, really important for us to continue listening, to hear our community partners, to hear the folks, to listen carefully to the folks that are getting the help from our students to the extent that it's help. But to listen very, very deeply to understand what the challenges are that people face, how those challenges are changing. And certainly with COVID, the changes have been dramatic, and that's required us to adapt fairly rapidly. Next slide, please. Okay, I'm about to give you an overview, just really quickly, of the ways we engage. But before I do that, to follow on with a little further the language of ethos, when we keep in mind the health and welfare of our constituencies, we are simultaneously aiming to increase their awareness of the challenges that everybody else is facing. I often say to people, it's always more complicated than you think. And it's not that we want to scare people, or students particularly, away from the complexity, but help them to learn to navigate the complexities and help them be able to be, you might call it, more surgical in their understanding. Think in careful ways of slicing and dicing the challenges so you can do a better job of helping the folks or working in partnership with the folks on the front lines. COVID certainly has brought these into sharp relief, as I mentioned. In the face of both necessary isolation and low levels of institutional and social trust, the community building has been even more important and much more difficult than people used to even think. Luckily, as you'll see from what Isabel talks about in a little bit, our students are hungry to do the difficult work and have stepped up to take on the challenges in whatever form available, remote, virtual, or hybrid. So reviewing the different ways we're engaging, there's four areas I'd like to highlight: the types of work available and the levels of involvement, the opportunities in a dozen action areas, some options and impacts. And then after we hear about Isabel and the work that she's doing, the impact she and her team are already having, then I'll tell you a little bit about the scale of engagement, do a little bit of a wrap up, and we'll take some questions from you all. Next slide. Okay, so we think in terms of the work available, we want to make sure that students have multiple entry points. You don't have to decide that you're going to get paid work with our office, though you can. You don't have to decide you're going to get academic credit. You can volunteer, you can do summer internships. We think across a broad spectrum of ways to engage so that whenever a student comes to us, to any of us, including our student leaders and student staff, when a student comes and says, I'm interested in X, Y, or Z, we feel compelled, we feel the responsibility to find something for them. Okay, to make sure that there is a pathway for them to get on. They can get started doing pretty much anything in any area they want. And so we think in terms of these on this right side, the different types of involvement. So we want open drop-in opportunities. And some of the examples I can give of those would be, we have what's called the WRAPS program, Williams Recovery of All Perishable Surplus, where you can just pop in on the days that people are organizing this and go and help recover food from dining services that was made but not served, prep it to be frozen and to be distributed. And you can help with distribution in the community into housing communities or programs where folks are in need of food. And that could be anything from some of the low-income housing communities, some of the elder communities, or some of the community work that's happening in terms of student programming. So there's a program called Playwright Mentoring, where we now have folks organizing, collecting food, even from different nonprofits, to make sure that the food is there. So when the kids in that program, who are usually kids of very limited means and of challenged circumstances, they can either eat there or bring home a frozen meal or some meals to their family. So the idea is to be part of that system. You can just drop in and help and then learn more. That's one example of the kind of open drop-in involvement we arrange. There's one-time events like the Great Days of Service that are run by the Lehman Community Engagement Group. And we support those student organizations setting up those kinds of special events. We help identify the kind of one-time activities that might be done. That might be helping paint the house of someone who is disabled and can't manage the funds to get someone to do that for them, or helping with rearranging or moving things for people, as well as outdoor work. Sometimes folks have cleared out the yards of people who've either become unable to do so or just financially unable to get the support they need. Then there's weekly, monthly, and seasonal work. A lot of our weekly work, in fact, most of it that's paid, is work in the local schools in a variety of capacities. Students can teach, tutor, and mentor. I'll tell more about those examples a little bit later. A lot of those opportunities. There's also monthly options like read aloud programs in the schools, and then seasonal opportunities that will occur over the summer, over winter, or in the fall when there's activities that need help in our community. And that could be an outdoor education program that needs support or needs students to help mentor the people who are getting support. The winter study and summer internships, we sponsor and support a lot of winter study courses where students can do field work in the community. We also support students doing summer internships by identifying community partners they can work with. They can get funds through other offices as well as our own to do research. And we also run a training program over the summer. The winter study courses range widely from things like teaching kids in elementary school about genetics, to fieldwork courses like the one that Isabel participated in to do her fieldwork in public health. We try to, again, provide a range of options, ensuring that whatever a student wants to do in whatever way they want to do it, we can find something that fits for them. So we think, I suppose you could say it's a contingency model. We don't think in terms of we have set things you have to adapt to us. We think in terms of adapting to a student to try to figure out what way we can make it possible for them to advance their learning, their experiential learning, and then fit that into the rest of their learning trajectory at Williams. Next slide. So I mentioned a dozen action areas. This is the way we kind of segment to try to make sure that we've got the coverage we need. If we don't run a program in these areas, activism, arts and culture, at-risk youth, education, if we don't run something specifically in these areas, we make sure that we've got ways for students to get engaged in work that the community is already doing. So we find the hosts. So we take seriously each of these areas. We want to make sure that if a student is excited about that work, we will either have something already functioning that we can direct them to, make sure there's a partner on campus that's running something that they can work with, or we literally work with community organizations to figure out what would make sense for them. So we take very much an individual support approach to this, so that, again, no matter what the student comes to us asking about, we can help them find a pathway that will make sense for them. That might be helping them come up with a winter study option where they're going home to work with a community organization home that fits the area of interest that they have and will give them the experience that they're looking for. Next slide. Okay, some options and impacts. There's a lot to give you here, but I just give a few of these as examples because this is the kind of work that we've done and help students do. We do a lot of organizing, teaching, tutoring, and mentoring in the schools, in large part because you can't just walk into a school these days and offer your services. They really need people to follow their protocols. We really make sure that we've got good partnerships with them. And that usually means when it's a very stable, long-term relationship, we've got protocols that students have to follow. When COVID struck, we quickly modified our protocols and student sort of contracts with the schools and with us to make clear that if you're going to do something online, you've got to follow certain kinds of protocols. As you might imagine, students might be thinking, great, I'll go online in a Zoom call. Well, have you checked your background? Is anything there problematic? How are you communicating? How's your setup in terms of audio and the like to make sure people are understanding you? So we want to make sure that the protocols that are of concern are followed by our students and by our teams. And frankly, when we did that, we scrambled and looked for best practices at other institutions. Bigger places like the University of Michigan already had a lot of online protocols. So we were not ashamed. We acknowledged where we got the information. We're not ashamed to go and find out what other people are doing and borrow their best practices so that we can learn from them and stand on their shoulders instead of reinventing the wheel. That has been our mantra for a long time now, because we don't have time to start from scratch, and we want to take advantage of what's been created across the board in other schools and programs like ours, and folks doing more sophisticated work like you all that we can reach out to learn about best practices, including that fantastic Health Matters curriculum, which we are already just mining, just really excited about it, helping our students learn by looking at your work as examples. So these other examples, helping low-income taxpayers file for refunds. We train students in a winter study course. They volunteer in the spring. They get a free meal. We do it online when we are doing this in person. We've had to do it remotely last year, and this year it's a little hybrid, but this year we're still on track to get maybe as much as those refunds we've gotten in the past years with a larger number of clients. We're excited about being able to sustain this program. It hasn't been easy, but our students have stepped up to help. And this year probably is the worst most confusing year for income taxes. And I say this having led this program for about 15 years. So these are challenging times, and yet our students keep stepping up. So it fills me with pride to think that they don't bat an eyelash when we say it's complicated, let's do this. The clients have really been stressed out, but our students have been tremendous help in getting them through these difficult periods. Inmates, when we had, especially in the tutoring realm, students weren't able to go because the House of Correction couldn't let anybody in, but they quickly pivoted in this program. We're back in person now, but during the worst of the pandemic, they basically generated little tutorials, online video tutorials for certain sections of the HiSET test to help people work through these issues. What's really exciting about that is that we've worked with the adult basic education people, and now we're able to share those same tutorial videos to the wider community, and we'll keep doing things like that. Use in one area can often mean you can use these things in another. And to step back to think in terms of teaching and mentoring, one of the other developments during COVID, which I'm particularly proud of, is that we rallied some students who were keenly interested in working on racial justice, in the racial justice area. They worked totally remotely to create new curriculum that addressed racial justice problems in K-12 curriculum. We're still working on getting a lot of that curriculum material online through a regional online network so that teachers all over the districts, all over Berkshire County, but folks outside can look at these materials and draw on them. There's more, certainly stuff out there, but in terms of adapting to the Common Core standards and making sure that folks have added good material, our students have really done some amazing creative work. I can tell more about that if people are interested. But when I hear about you all talking about the need for more curriculum, it makes me think, wow, I would love it if some of the curricular best practices you all are finding are the kind of things that we can look at, and even then encourage our students, once you develop a model for how to look at this kind of challenge, the way we've done with the racial justice K-12 education, it seems to me you can then invite others in a kind of a, what they call, open source. What kind of materials have people done out there? How can we bring them to a central location so that others don't have to reinvent the wheel? Teachers on the front lines, clinicians on the front lines can draw on this material, and we can build a kind of a groundswell of improvement that is just really hard to do when everybody's siloed. But in opening these things up, and especially you all with your fantastic protocols and guidelines, it just feels like we could encourage more folks to join you in these missions that you've got related to improving the quality of treatment, of training, especially on the part of clinicians. And finally, the one on basic optometry. Unfortunately, that one has gone a little bit stalled because Nicaragua has some real political problems, but folks are working on shifting to new locations to do similar kinds of mobile eye care clinics in other rural areas where these resources are just not available. Some of us are thinking about the potential to do these things domestically, because there's certainly parts of this country where people don't have access to decent optometry services. So we are always thinking about how to go to the next level. And it's our students that push us in this thinking, because they have the energy and the willingness to do the work. Next slide, please. Great. So these are just some images from some of the things we've done. We can move quickly through these. And at the end of these little images, this is the Volunteer Income Tax Assistance Program. The two students on the right are supporting the client on the left, who didn't mind us taking her picture. Students have helped with simple things like moving the Berkshire Immigrant Center. Next slide, please. Creative projects, a student group called Be Fair Buddies has been going gangbusters and working with the folks in some of the group homes in our region that are run by Berkshire Families and Individual Resources, which is the organization that assists and has programming for adults with disabilities. It's a wonderful organization. They do great work. And our students have built some amazing relationships and really have had a lot of fun. And frankly, this is something I think when we think about community building, I have to say that one of the reasons why this work is so valuable and so rewarding for those of us who do it is because our students benefit, and we know and they know, they benefit tremendously from these relationships outside of the campus. This can be a high pressure institution a lot of times. And students feel like the person next to you is always smarter than you, always knows more. And you yourself are thinking, wow, you can be so self-critical. We have students that strive, but they also are intense. And being able to engage in another community, to be in community with other people who are not looking at you as someone who's like, you're not doing that well in that class, are you? You don't look so good these days, do you? People who feel and appreciate our students for who they are, and our students appreciating them for who they are. And together they develop projects, fun projects, rewarding social projects, rewarding creative projects, where everybody can feel very good about what they've done. And what you see there in that image is some little snowmen that were made in one of these creative projects that was done just before the holidays. And everybody thoroughly enjoyed the experience. And our student leaders who organized this have said, all our students come back feeling so much better. They get so much more from the experience of working with these folks than they give. And it's that kind of reciprocation and mutual benefit that we're always striving for. And it's huge because it gives students a perspective on a world outside of what can be a pressure cooker here at Williams. Similarly, the Making Mittens drive, we had starting in January, we had some students, we gathered some material, we got a bunch of sewing machines, we taught students how to sew in some cases, and they were making little fleece mittens, and we gathered other supplies for kids at some local elementary schools who are in dire need of warm clothing. The teachers are telling us they're outside at recess without anything on their hands, and they can't go out when they don't have ski pants when it's snowy. So this is a response to a need, but students learning skills and also enjoying themselves greatly, gathering together in a social enterprise, a social experience that fills them up, gives them skills, and helps them feel better about the community that they're supporting. Next slide. And then finally, we have students who teach science in the local schools, and other students who've organized community cleanups in the region whenever folks are asking for it. Again, teaching people how to use loppers and other kinds of tools. Not many people have done so in the past, and so these become opportunities to build skills. We listen to students when they ask for skill building. We also listen to organizations when they want skills built, or they want students with skills to do certain kind of project work. And what you're going to hear next slide, will be from Isabel telling you about the project that she worked on, that has been working on since the beginning of winter study. So I'll let her take it away to tell you about what she's been up to. Isabel?
Thank you, Paula. Thank you everyone again for having me here today. I guess just to jump right in, as I mentioned before, I'm a public health concentrator at Williams, and part of the curriculum is a field-based experience with a research component to connect what we learn in the classroom to interactions and dynamics in the real world. And when deciding what I wanted to do for my experiential learning component, I didn't really have any connections in the public health realm. So I was advised to reach out to Dr. Consolini at CLiA, and she shared an exciting idea to develop a health coach program at Williams. And with in mind to have students work closely with local public health actors to address health disparities in the community. And since I was struggling to find a fieldwork opportunity, I was excited about the potential to build a more organized fieldwork opportunity for Williams students to ensure that everyone interested is able to observe the interrelationship of individual and social choices with demographic and biological factors that affect health, and specifically in our local context. And developing this program will allow students to build on the work of those before them and really allow Williams to make a long-term commitment to improving health outcomes instead of having individual students work in silos on many of the same issues on different projects throughout the years. So during the month of January, students are given time to immerse themselves in an interest that they're choosing through different classes, projects, hands-on learning. So the project I was a part of took the form of a winter study course, and it was organized as a task force. So we broke up into smaller teams with individual work streams of about 2 to 4 people. And we all met once a week over Zoom as a collective group and sort of talked about what we found that week and how to move forward from there. And ultimately, the overarching objective to improve health outcomes for underserved population in the Berkshires is really general and quite the ambitious tasks. So we're primarily focused on understanding what could be possible in terms of a student health worker role at Williams, and specifically constraints and challenges that would impede successful implementation. So I spent the bulk of my time identifying and interviewing community health workers and potential institutional partners to learn more about existing programs and resources that could equip Williams students with the skills and knowledge to engage in this type of work. And for me personally, this was the most open-ended project I had ever been a part of. And given that there were no obvious steps or guidelines, it was really on each and every one of us to reflect on each interview and every finding and determine if and how it was relevant to the broader goals of the project and how it could guide us towards a logical next step. And exercising this type of critical thinking really forced us to ask like the so what and where do we go from here sorts of questions. And that made the experience all the more meaningful and really helped us tailor it to the needs that we identified and the demand for student volunteering and work. So the biggest obstacles we identified throughout the month were integrating health coaches with care teams that are already really overwhelmed and understaffed, and also trying to reconcile the inevitable transience of undergraduate students with the crucial role of building trust with patients and organizations over time. And another sort of caveat was that many of the people on the task force were actually dropped from another course. So things were definitely a little bit disjointed in the beginning. People were in different time zones, but even with all of those complications, we were still able to research major pain points in the local healthcare system, certify a group of students in basic life support and first aid, identify potential institutional partners, research existing health coach programs, and bring this all into an executive summary, which also was a great exercise of reflection and really helped us synthesize what we had found and leave sort of a document so that whoever picks this project up next could sort of build upon what we had found. And we really thought that whatever form this health coach program takes on, ensuring that there's continuity over the years is really crucial to its success. So right now we're really trying to lay down the foundation for a positive pipeline of public health research and work to operationalize community health outreach at Williams. So students are able to gain practical and professional experience and really appreciate the real world challenges inherent in public health, whether that be understanding like how long it takes people to get back, like different like rotating staff, like especially with COVID, there's a lot of more restraints on the healthcare system. So experiencing those complications firsthand was really eye-opening for the team. And one of the populations we identified where we really believe Williams students could make a meaningful impact on health outcomes without necessarily needing to be directly involved with direct care delivery is individuals with intellectual and developmental disabilities. And this objective is actually what led me to contact Dr. Sisterak and Dr. Marks about the Health Matters program. And just we wanted to learn about the curriculum and how we could draw from their research to train Williams students to put on health promotion programming for individuals with IDD. So building off this work that I was a part of during winter study, I'm now working in coordination with the local human service agency, Be Fair. And we want to start on a small scale, but just putting on a field day to engage individuals with intellectual and developmental disabilities in an afternoon of fun and physical activity. And our plan from there is to then gather feedback from volunteers, the Be Fair staff, program participants to reflect and assess the event so that we can tweak on it and build upon it for next year. And the idea behind this is that we don't think a program of this nature can really be built on a year, but using feedback with students that help at the event, we can adjust the curriculum used to train them. And ultimately, we want this to evolve into a menu of comprehensive health programming so that we can really build healthy habits in Be Fair residential homes regarding nutrition and different types of movement. But all in all, this opportunity has really helped me gain firsthand insight into what it's really like to coordinate with different actors in the public health sphere. And I'm really excited about the potential for Williams students to engage with the Berkshire community, to both make a meaningful impact on health outcomes and also gain experience that will prepare students and inform their decision to work in public health after graduation. And yeah, that sort of sums up the work I've been working on and sort of where we're going from here, but I'm really excited about it. CLiA has been such a great resource for all public health students that want to engage with this work. And yeah, I'll pass it back to Dr. Consolini now.
Okay, great. Thanks, Isabel. As you can see, there's incredible power in the energy and the work ethic of Isabel and her team. Very proud of her and all of them for the great work that they're doing and for the work that this will help build over time. So the next slide before we take questions is just a little bit of the numbers, the scale of our engagement, and then Beth has already shared with you our website and email address, so I think you've got that information. But since time is short, I think we'll move quickly to see if anyone has any questions or observations from what we've shared.